I'm here in the home of Shirley and having the opportunity to talk with Shirley today. So, Shirley, tell us a little bit about yourself.
Well, I'm 88 years old, and I live in a home in Florida, and I manage quite well for myself. I do have help with my lawn, and I have help with cleaning, and I go to the store by myself and do most all my cooking.
Great, good. So, have you lived here a long time?
Yes, 25 years.
25 years. And you've been on your own that whole time, or?
Well, my husband passed away 14 years ago,
Okay,
so
you've
I've been on my own since then.
so you're coping well. And tell us about your normal daily routines.
My normal daily routine is go to get out of bed, shower, take medicines, have my breakfast, and then if I have to go someplace, I get ready to go. And if not, there's always projects in the home. I still try to iron and do my own cooking, and have to go to the grocery store.
And what kind of things are your interests that you enjoy doing besides kind of the daily chores?
Well, I love to go to concerts. On occasion, I like to go to the movies, and I like to go out to lunch and go to some church activities and be with friends.
Great.
With friends.
Good. So you mentioned earlier that after you get up, you take some medications. So tell me, what kind of medications are you taking?
Well, I take heart medications, I take thyroid medication, and I take medication for hiatal hernia.
Okay. And do you take many medications in total?
Yes, quite a few.
Quite a few. How many is quite a few?
Well, I think there's at least 11. Well, and then I take medicine for asthma.
Okay. Yeah. So that's a lot to keep track of, isn't it?
Yes, it is.
Managing all that medication. So you mentioned you take some heart medication. So can you tell me more about your heart condition or conditions?
Well, I have atrial fibrillation, congestive heart failure, heart murmur, on mitral valve.
Okay. And and do you have arrhythmia or?
Well, yeah.
Yes, you've got arrhythmia. And how are you managing the arrhythmia?
Well, I have a pacemaker.
Oh, okay. Did you get a pacemaker recently, or have you had it for a while?
No, I've had two, and my second one is in the process of the battery wearing out, so it's going to be within a couple of months. I'll have to have a new battery put in.
And how do you know when it's time to change the pacemaker?
Well, normally I go every 6 months to a technician in my doctor's office, and he has a machine that tests it, and he can tell when the battery's starting to get low, which is, like I said, is doing that now.
Okay. And does the pacemaker control your arrhythmia?
Oh, yes.
Good. So you don't need any medicine then for your arrhythmia?
I don't know, maybe one of those heart medicines help, I don't know, but
okay.
It seemed the pacemaker.
So it controls it, and you don't have any more arrhythmia?
Oh, I still have it, but
you still have it. Okay.
Yeah,
so the pacemaker didn't get rid of the arrhythmia.
Oh no, it just keeps under control.
I see. So it doesn't go
too high or too low.
Yeah. And you mentioned that you had some congestive heart. Is that something that's new, or have you had it for a while?
I've had that for a while, but it's progressing. It's getting worse.
Okay. And how do you know it's getting worse? What have you noticed?
Well, I notice because I have more difficulty when I walk to breathe.
Okay.
With any exertion,
okay,
it's getting more difficult to breathe.
So it's harder to breathe. And what do the medicines do for your congestive heart?
Well, I guess It helps.
It helps. Does it help by getting rid of the extra fluid?
Well, I have to take diuretics, so I get rid of the extra fluid
I
around
see.
my heart, yeah,
Mhm.
which the congestive heart failure causes.
Right.
The extra fluid.
So the medicine that you take to get rid of the extra fluid, the diuretics, is that at certain times of the day, or do you have to take that every day, or how often do you take
Oh,
those medicines?
I have to take it every day, and it's
Okay.
best if you take it in the morning
Uh-huh.
because it works faster. But if can't be, why I'll take it in the afternoon. You know.
So how long does it take for the diuretics to take effect and to get out of your system? Is it an hour or 2 hours, or how long?
Well, if you take it in the morning, within about 3 hours, it's over with. But if you take it later in the afternoon, it's like 4 hours.
I see. So I guess that means that you can't go too far from home when you have to
Exactly.
take those diuretics. It changes your lifestyle a little bit there in the
Definitely.
mornings.
Definitely.
Got it. And tell me, do you have any breathing problems, any lung problems
Well, I do have breathing problems, definitely.
from the
because
congestive heart? And
Yeah,
do you have any lung disease?
I do have some lung problems. I don't really know
Is it
the correct name for it, but I do have it, and it's more on my right side.
Mm-hmm. Is it COPD or asthma or
No,
bronchitis?
it's asthma. It's not COPD.
Okay, so it's asthma. Do you
Mhm.
take any medicine for that?
Yes.
Uh-huh. What kind of medicine?
I take two inhalers.
Oh, inhalers for that. Okay. And generally that controls your asthma?
Yes.
Great. Good. And tell me, do you have any arthritis?
Yes.
Tell me about that.
Well, I have arthritis in my back and in my neck and in my hands.
Mm-hmm. And sometimes people have something called degenerative joint disease. Do you have that?
Yes, I do.
Yeah. Okay. So how has the arthritis impacted you?
How is it? Well, I can't do as much as I used to be able to do.
Mhm.
I have to.
Because of why? Has it cause you pain or weakness or
Causes weakness.
weakness?
Yes.
Okay. Do you ever have any shooting pains from it?
No,
No, just more of a weakness.
more of a weakness.
And where is that arthritis located?
It's in my hands and it's in my back and it's in my neck.
In your neck. Okay. Okay. And do you have any other medical problems such as thyroid or eye problems or
Well,
gastrointestinal problems or?
Well, eyes. My eyes water a lot, so I take medicine for that. But
Okay.
it's not serious.
Mm-hmm. So nothing like cataracts or
No,
macular
I had
degeneration?
cataract surgery years ago.
Oh, okay. And you don't have macular degeneration?
No,
or,
fortunately.
no, great. No diabetes?
No diabetes.
Great. And any thyroid problems?
Well, I do have some thyroid problems, but I take medicine for that.
Okay. And
And I
is
did
it
have
underactive or overactive?
Overactive. I did have thyroid surgery.
Ah, okay. What did they do with the thyroid surgery?
They took like 2 little tumors out in part of my thyroid.
Ah, okay. And then were you on medicine before that?
Yes.
And then you were on medicine since then for the
Yes.
thyroid. I see. Okay. So in terms of all of these various medical problems, what would you say is the biggest area of difficulty for you? Is it in your walking? Is it doing the things you enjoy doing? Or what is most challenging for you?
Well, probably walking and activity because of the difficulty breathing.
Mm-hmm. So would you say your congestive heart limits you the most?
Yes, I think so.
Uh-huh. Okay. All right. And you mentioned that you thought it was getting worse. Is that from your own observations or what the doctors told you, or
Well, the doctors have said that. Yeah.
they've said that too?
Mhm.
Okay. And how have you, because you're still living alone, so how have you modified how you do daily activities? What do you do anything differently than you used to?
Well, I have help to clean my house,
Mm-hmm.
and then I have help to clean my yard. I actually help, they do it, you know.
Mm-hmm. Okay.
I don't have to do that.
Do you find you tend to sit more than you used to?
Yes, I sit more than I used to.
Mm-hmm. Okay. And do you have any equipment that helps you out?
Well, I have a cane and I have walkers.
Does the walker have wheels on it?
Yes,
Mm-hmm. Oh, you said walkers plural, so do you have several types?
I have a sit-down walker, if that's what you call it, and a regular walker.
Well, a regular walker, and that also has wheels?
Yes,
Okay. And the do you have any equipment in your bathroom?
yes, I have some grab bars.
Okay.
And we're in my shower stall.
Mm-hmm. Any grab bars in the toilet?
Yes, I do.
Okay, great. Those probably help out a lot, don't they?
Yes, they do.
Do you get tired when you're taking a shower? Do you have something to sit on?
No, I don't, but I can do it. It's
You can stand
stand, I can
long
stand,
enough,
yeah.
so you don't feel like you need a bath seat.
No,
No. So you live alone. Have you ever been concerned about safety? Do you have anything to help you in terms of safety?
well, I have an alarm system on my house, which has a direct line to the police. and
Great.
Fire, and then I also have a watch that I wear.
Mm-hmm.
That's connected if I need help. I can-
Okay, so it's one of those, you push a button on the
Yeah.
watch?
Right.
Okay, great. Good. And does that system work when you're outside the home?
You have to take a device with you, a little
Okay.
device.
Uh-huh. Do you do that?
Not if I'm in the car, I don't take it,
Uh-huh. Okay.
because you can get help from the police so fast.
Mm-hmm. And so what would you want students who are learning about heart and lung problems, what would you want them to know about having these different heart and lung problems from, somebody who's living through it?
Well, you just have to keep trying.
Uh-huh.
Try to do your best and keep walking and, and try to be as active as you possibly can.
Great. Anything else in terms of parting words for the students?
Yeah, I hope everybody stays well.
Okay, thank you so much, Shirley.
You're welcome.